My name is Nos Hilary. You are welcome again in my YouTube channel. If you have not subscribed to my YouTube channel, do and subscribe so that you will see videos anytime I make an amazing post like this. Okay, in this post, we are going to talk about the difference and similarities between BSc nursing and HND nursing. Okay, now the aspects that I am going to cover in the differences and similarities is going to be including the training structures, the qualifications that both of them have, the career prospects that both the BSc nursing and HND nursing have, and the academic progression as well. Okay. All right. Now, what are the types of program and the institution? Okay. Let's take, for instance, in BNSC nursing, this is a university-based academic degree that is offered by what accredited Nigerian university, and it combines both nursing sciences with clinical practice and also research and theoretical learning. The award that is given in these types of program is called Bachelor of Science in Nursing. Okay, and names of institution that does this kind of programs is mostly every university in Nigeria does this kind of what program. Example is University of Lagos, University of Nigeria Nsukka, and Ahmadu Bello University. Okay, all right. Now, what are the entry requirements if you want to study BNSC nursing? Number one entry requirement if you want to study BNSC nursing is that you must have 5 credits in your WAEC or NECO, and those credits must include English language, mathematics, biology, chemistry, and physics. And you should bear in your mind that admission is competitive and it is based on merit. So you have to read and be able to have a very high score in order to secure BNSC nursing admission. Okay, but for HND nursing, it also requires the same thing. Yes, but the cutoff in uh, in College of Nursing, which is where these are located, which is the HNDs, are mostly a bit lower compared to those that are going to university to study it. Okay, all right. Okay. I'm going to tell you the duration of study for BNSC nursing and also the duration for study for what? HND nursing. Okay. For BNSC nursing, it is a 5 year of academic and clinical training program. Yes. After which you will use 1 year for internship and also 1 year for NYC program. Okay. But for HND nursing, it is a 4 years academic what? Program. Okay. And you will use 1 year for internship and also 1 year for what? NYC after graduation. Okay. So now, what are the licensing and the certification between the two? The good thing about having both HND nursing or GNC nursing is that both of them offer a registered nurse license and registered midwife license, and also public health nurses, okay, or public health nursing license. Yes, during the period of your study, you are going to bag RN, which is registered nursing license, RM, which is registered midwifery license, and what? Registered public health nursing license. And this is the similarity between these two types of programs. So if you watch the program very well, you will see that there is no much differences in their two. Okay, they have the same scope but different uh, way of study. Okay, let's go to how the salary and promotion between BNSC nursing and HND nursing looks like. Okay, for BNSC, once you are employed, you start with grade level 8 in any government what establishment. And one good thing about those with PNSC nursing is that they rise faster in rank due to their academic qualification. But those with HND nursing, they once they have employment, they start with what? Grade level 7. Yes. and may need to upgrade, okay, in their qualifications in order to have higher administrative roles. Yes, okay. In terms of further studies and specialization, as a BNSC nurse, you don't need anything. For you to do your master's, you can do maybe master in public health directly without any form of maybe further study or anything. You can do your master's in psychiatric nursing, you can do your master in pediatric nursing and PhD as well. But as a HND nursing, you have to do what we call postgraduate um, diploma, which is PGD. Okay, it's the same thing as what BSc conversion program that you have to do for like 1 year before you will be able to go and do masters. Okay, so that is a bit different, okay, between these two scope of practice. Okay, based on NYC eligibility, yes, both BNSC nursing and HND nursing go for NYC. Yes, now as it stands now, both of them have the two opportunity to go and serve. Yes, okay. Um, Based on the recognition and perception, okay. In BNSC nursing, people often consider it as prestigious uh, in Nigeria and both in abroad. And if you watch, you will see that yes, what the abroad knows is bachelor in nursing science, and they don't know much about anything like HND in nursing and the rest. So, and a lot of people say that BNSC nursing is better suited for leadership and administrative role. And yes, I will say yes because in terms of employment, you will see people who are BNSC being considered first before those that are what HND inclined. Okay. However, HND nursing is still respected, especially because they have hands-on clinical skills. They are very good when it comes to anything that has to do with performing practicals. Okay, even though they face some kind of limitation in some non-clinical roles, because anytime you employ or both the BNSC nurse and HND nurse is in one hospital, that of BNSC is likely to handle some administrative function because of their qualification or the rest. So at this point, we have come to the differences and similarities between these two scope of practice. Yes. So if you have not subscribed to my YouTube channel, just try and hit the like button so that you will see an amazing videos anytime I post. Thank you for watching.